Okay, settle down, settle down. You're probably looking at the title of this video and being like, what is he talking about? I'm gonna dislike. But before you hit dislike, I'm going to explain myself in this video. Yes, this is a video I've been wanting to do for a very long time, but I didn't know how to present it because it's a very, dicey issue. But then Dr. Z-Dog MD came out with his own version from the attending perspective about this issue. And then Dr. Kevin Jubal from Medical School Insiders came out with his own version from the resident perspective. And then John Oliver came out with his own version, which is tied in, which is showing you the public and the patient perspective. And I was like, you know what? Everything's aligning, and I guess it's time to give you the medical student perspective. So here we go. Let's talk about burnout, which some people call moral injury. And I can talk about this issue for literally 9 days straight. I can give you a full TED Talk conference about my thoughts on this issue, but I decided that for this video, what I'm going to do is I'm going to focus it down, because once you focus it down, you can really hammer home the point. So what we're going to talk about today is specifically the concept of sleep in medicine. You might be thinking, oh, okay, whatever, sleep. The reason we're going to talk about sleep specifically is because of the lack of sleep that is demanded in medical training. I know in other fields, and especially in college, people are like, oh, I don't sleep too much. And I've had those days too in college where you have to pull all-nighters, but never in my life have I been expected, or my colleagues, to stay awake for 24 hours. It was something that really blew my mind away, that if a patient came into us and was like, oh, I've been pulling all-nighters, we're like, why, what happened, how are you so stressed, what's going on in your life, you shouldn't be doing that, sleep is so important, these are the effects of sleep and sleep deprivation. Then we turn around, look at our residents, and be like, your 24-hour shift starts right now. So for me, it was really boggling to have that kind of experience, especially as a student. So as a student, we had to pull 24-hour shifts, which would turn into 28-hour shifts because you have to wait for sign-out the following morning, and sometimes I'd be pulling 2 24-hour shifts a week, and I would be sleep deprived, and it was really a difficult time just because of the demands that were expected of me. And it's not like, oh, I was putting myself in that predicament. I was expected to work 24 hours, which is the difference from other fields. I know for many people, procrastination is a huge thing, and people end up pulling all-nighters, but I don't know any other field where you are expected to stay awake for 24 hours straight, and that was the expectation. That's what we're talking about here. And it's odd because even if a field does that, we are the human champions. We study the human body and its limits and its, super capabilities. And one of its limitations is that you need sleep. And we know that, and we've studied it, and we tell patients about it, but then we turn to our residents and we're like, that patient just pulled a 24-hour shift and it's unhealthy, we're going to recommend that they don't do that, but then your 24-hour shift starts right now. And for me, that's a really implicit way to tell residents and students and attendings that they are different kinds of humans, almost to the point that they are subhuman, where they need to be treated differently and in effect, worse than the patients are being treated. So these are patients who have their own lives and need to be protected and healed, and these are not humans and they need to be pushed and worked to exhaustion. So that's why we're talking about sleep. And we're going to put this in the context of SIGI caps. This is how we diagnose major depression disorder, and every medical student learns it along their medical training. It's a nice little acronym to help us learn it and remember it. You need 5 of the following 9 symptoms for a duration of 2 weeks or longer in order to be diagnosed with major depression. Let's run through it. The very first S is sleep. If you're sleeping more or less, you get that ding. And medical students, when they are forced to stay awake for 24-hour shifts, or residents when they're forced to stay awake for 24-hour shifts, or attendings when they're forced to stay awake for 24-hour shifts, they are having less sleep than usual. So sleep is dinged. Interest. If your interest goes down, well, if you're sleeping less, you're probably going to not have interest in trying to go use hours that you finally have to yourself to go watch a movie with your family or to Netflix, because you're going to need to go and sleep. So your interest in those kinds of things diminishes in an effort to regain some sleep that you've lost as a result of forced hour expectations that are above normal work regulations. And I don't mean work regulations within medicine, because I know everyone always cites that you can work up to an average of 80 hours for 4 weeks, and that's the standard in medicine. It used to be 120. Was pushed down to 80, so it seems that it's softer now, but still, when you compare it with our colleagues in other professions, they're not working as much as we are, and if they are getting compensated for it. In medicine, it's the one field where you're expected to work this much, you're not compensated for it, and at the same time, you're expected to be humanistic. Meanwhile, the people who have set the protocols in place for you are not treating you in a humanistic way. So let's continue going. Next one, G, guilt. We're not going to ding this one just because not everyone is guilty. I mean, you can have some sense of guilt when you're not sleeping because you end up using those hours outside the hospital to catch up on sleep, so you can't go out with a loved one or a family member or do things with the family, go to a celebration, go to a funeral. You're feeling senses of guilt, or you're working so much in the hospital that you can't go to these events, so you end up having a sense of guilt. Not everyone will experience it. Yes, it's more likely that you will, but in an effort to give it the benefit of the doubt, we'll just say that we don't get the G point. E, energy. Of course, when you don't sleep, your energy level is going to go down. Basic science. Next, C, concentration. When you're not sleeping enough, of course your ability to concentrate is going to go down. So we get the C point as well. Then A, appetite. When you are not sleeping, does your appetite change? Heck yes. Because it's not like you're just staying awake for 24 hours like at a desk job or, playing video games. It's you are staying awake doing actual clinical work that's impacting patients' lives and could kill them. So you are forced to be fully aware and fully conscious. And in an effort to do that, your appetite either goes up where you're going to need to eat more snacks in order to stay awake so you don't fall asleep, or you are awake for so long doing such intense work that you forget or skip meals. So your appetite is changing either more or less, so we get the A point. Next, P, psychomotor retardation. We're not going to ding that one. Lastly, S, suicidality. Are you having any suicidal thoughts or ideation? We're not going to ding that one just because not everyone has suicidal thoughts, but it is very common that if you have depression untreated, you will lead to suicidal thoughts. So this could be something that eventually becomes dinged, but because we're trying to give it the benefit of the doubt yet again, we're not going to ding S. So after that quick little run through, let's see how many we got. Sleep, interest, energy, concentration, appetite. And that was with us being very generous. There are some here that you might end up having also as a medical student or medical resident or attending who's expected to lose sleep in an effort to pursue their medical training or medical responsibilities. So that's 5 of the 9. If you have those symptoms for 2 weeks, congratulations, you've just been diagnosed with major depression disorder. Now, for those of you who are saying that it just so happens that medical students end up being the kinds of personalities who do become more susceptible to depression, there was actually a study that looked at this. It found out that when compared with other college graduates, matriculating medical students who are about to start medical school actually had lower rates of burnout and depression symptoms and higher scores of quality of life. As we just showed, sleep deprivation can lead to depression, and we all know that depression can lead to suicide. But it's not like sleep deprivation is the only thing that medical students have to face. Medical student debt has increased more than 50% between 1998 and 2008. When I read that statistic, I was like, oh, the 50% increase until 2008. And I was like, hold up. We're in 2019, which is over 10 years past 2008. So to everyone who's saying, back in my day, all this and that, back in your day, debt wasn't as huge as it is now. Right now, debt is crippling for so many people. The average tuition cost to attend medical school per year in the United States is approximately $55,629, which amounts to $222,516 in tuition debt for 4 years of school. This does not include other fees like health insurance, housing, and living, let alone having family or other responsibilities, financial responsibilities that you need to take care of. And does not include travel costs for interview season, travel costs to take exams, or even paying for the exams that cost up to $2,500. I pay $40,000 every single year in medical school tuition. I don't know why some people are afraid of sharing how much they pay, but that's how much I pay. That does not include school fees, does not include living expenses, does not include paying for my other exams. I have to take 2 exams this year, my Step 2 CK and my Step 2 CS. Step 2 CK is $600 and my Step 2 CS is $1,300, and it's only offered at 5 locations throughout the country, so I would need to fly out or drive out, book a hotel, stay there, and then come back. Meanwhile, this is an exam that was initially put in place, the Step 2 CS exam, for international medical graduates when they're coming to America to see if they are proficient in English to deliver healthcare here in this country. Harvard Medical School came out with a petition to get rid of the Step 2 CS exam. At the end of the day, the way to sum up this whole issue, really and truly, and I've thought about this for a very long time, when I tell people, it finally dawns on them, is this. What is stopping the medical education system from putting in a Step 4 exam? We already have Step 1, Step 2 CK, Step 2 CS, and Step 3. They could put in a Step 4 tomorrow, and we can say nothing about it. We can do nothing about it. We have to then go and just, if they said that it costs $1 million, we have to find some way to pay for it because we already are so far in this whole system. We have so much debt on our backs. If they said that you need to lose all your integrity, lose your humanity in an effort to become a doctor, we have to do exactly as they say. And they don't think that's that big of a deal. When they were approached about medical student wellness, one of the directors actually said, this is a quote that was since redacted, but he said, if we do that, they'll have more time to waste on Instagram. Which really shows you the raw mentality of what these people are thinking about medical students and medical education. Back in their day, immunology didn't exist. My neuro clerkship director told us that she gave our neuro exam that is given to us by this board to the neuro attendings. These are actual doctors who practice every single day, and they found it difficult. They said that we can't even complete this. So if that's what medical students are expected to do, fine, thank you so much for the education, but don't make it a barrier for us to become physicians, especially when we have so many other things like our inability to have lifestyles comparable to our colleagues in other professions, our inability to sleep a regular amount of hours like we expect our patients to do, and an inability to be compensated for the things that we've been doing. When you work 80 hours a week at another job, you're going to get paid for it. Colleagues in other professions, when they pursue an internship, they usually get paid for it. In law school, when you're in between summers and you get an internship, you get paid for it. In medical school, you are paying every step of the way. Third year, when you are actually in the hospital working with people, and everyone will say, oh, but it's a learning experience. I realize why it's called a clerkship experience, because it's a lot of clerical work that you're doing. Faxing, making appointments. Yes, you get to talk to patients and learn, but you aren't getting paid. You are there paying someone else. And it makes you think, why has medical tuition exploded in cost when teaching modalities have made education so simple and streamlined? I don't understand why tuition needs to cost $40,000 for medical school, when the premier online resources cost at maximum $2,000 to $3,000, versus some professors who haven't updated slides since 2002, and newsflash, it's 17 years since 2002. Most of the time, the teaching is their last priority. They have clinical responsibilities, research responsibilities, familial responsibilities, and then like, oh yeah, I have to go teach the students for this 1 hour. So it comes in, it's a little frazzled, they forget which grade they're talking to. I can't tell you the number of times a professor has walked in, they're like, you guys are year 3, year 4? And we're like, we're year 1, we know nothing. And they're like, okay, today we're going to talk about heart failure. And we're like, what? We don't even know what the heart is. Today's day 1 of the cardio unit. You can't just start with heart failure. We need to know how things work. And it's happened all too much. Medical school is not hard. I believe that wholeheartedly. Wholeheartedly. But really, it's just so poorly organized and poorly taught, because you have all these people who are pulled in so many directions by administration, by insurance companies, by family, by expectations, and then you tell them to teach. Yes, they're smart people, but they don't always have the teaching capabilities that are required to be an effective communicator, an effective educator. It's sleep deprivation on top of enormous amounts of debt, on top of expectations, on top of exams that are being weighed against you in a way that they weren't even designed for. We cannot even begin. And this is why I was saying I had to focus on sleep, because it just like explodes into this huge conversation about the direction of medical education, or frankly, the lack of direction in medical education, because the STEP exams, which are used as our like national board licensing exams, they are not built in the way that they're used. The USMLE, the United States Medical Licensing Examination Board, came out and said, we make these exams hard at the passing level. Yes, you get a 3-digit score at the end, but it's not really that sensitive, because a couple of questions will shoot it between 10 and 15 points. And every single person in our field knows that, and very few people choose to follow it, which is so wild that we always preach evidence-based work and yet practice whatever is easiest for us to follow. And there's so much stress that rides on these exams, because everyone knows if you happen to have a bad day, or if you happen to, not sleep well the night before, your whole future effectively is destroyed. I myself, when I was going to my Step 1 exam, was stuck in traffic, which already gives you anxiety. But then when I finally got to the point of the traffic zone, it was a truck, and the truck decimated a car, and there was a dead body on the floor on my way to my Step 1 exam. And sure, if you can argue that affected you on your Step 1 exam day, but who's going to really listen or care about that? And that's frankly the whole situation. You end up being told you're supposed to be humanistic and caring to patients and loving and empathetic. Meanwhile, the system that is set up for you to fight against could not care less about you, to the point where you end up graduating medical school with an average of $200,000 in debt. And then you're supposed to pick a specialty. So why in the world would you ever spend 4 years putting yourself into more debt, sleep deprivation, all this exhaustion and mental headache and heartache and stress, and then choose the lowest paying specialty? Why would you ever go into primary care, family medicine, pediatrics, all these like wonderful things for prevention of disease, when you could choose a very lucrative specialty and go and make double or even triple what you would make in primary care? Which is, we are going to have a deficit in primary care, but no one really cares about it in medicine, seemingly because the focus is on putting people more in debt so that they are forced to pick a higher paying specialty. Also, these high medical school costs will decrease the amount of diversity that we have in medicine, as well as decrease the effective body of practicing physicians in primary care. So what needs to be done is to reduce cost, or else we're going to have a shortage of physicians, which is what we're on track for doing. So it's all on the spectrum. Now, I'm glad we established this point, because I have a question for you. Let's follow this really quickly and pay attention, because at the end you're going to have to answer a question. At the very beginning we said you end up with sleep deprivation and a lack of sleep, which mixed in with a bunch of other changes in your life will then lead to depression. And that's just one component of the medical student dilemma, not including examination, debt, testing, stress, expectations, none of that. Just the sleep component we've proven will lead to depression. Now, the depression, we know, untreated, will lead to suicidality. Now, the question for you, if you've been following us so long, how many medical students and physicians do you think go from the suicidal ideation point to actually committing suicide and taking their lives per year? Would you believe me if I said every single year we lose 3 to 4 physicians to suicide? That is crazy to me, that we have all these wonderfully talented and empathetic people, and because the system is so grueling and doesn't care about them, 3 to 4 people every single year kill themselves. And these are doctors. But I was lying to you. What if I said every single year 30 to 40 medical students and or doctors kill themselves? 30 to 40. Why are people killing themselves? How is it that these most heartfelt and humanistic beings who are so intellectual, what drives them to a point where the only solution is to take their own lives? It's crazy. And I was lying to you, again. Every single year, 300 to 400 medical students and physicians take their lives. And I don't know any other initiative that needs an intervention. This is public health priority alpha. This is unacceptable. And if when I mentioned 3 or 4 suicides per year, you thought that that was a reasonable amount, may God have mercy on your soul. There was an article that I was reading that said only 20 residents die every year, and only half of those are by suicide. And I could not believe that someone would ever say only before talking about a statistic of suicide. It shouldn't even be 1, let alone from our doctors. And if you're thinking, oh, well, this doesn't really matter, oh, you know, the intervention would cost too much and all that stuff, money is not the driving force here. This is an ethical question. But if your brain is so warped that you need to be convinced financially, there's research for that. Let's talk about it. It costs 2 to 3 times a physician's annual salary to replace them. Some studies have totaled this up to $990,000 per full-time physician, and other people find that it ranges from $500,000 to $1 million per physician. And this is not just speaking about physicians who commit suicide. This is about physicians who leave because of burnout, who feel that they haven't been listened to or feel that they've been pushed to limits that are inhumane, so they decide to leave the workplace. And get this, the turnover of any member of a care team increases the risk of burnout on everyone else because everyone else needs to pick up the slack. Even if they hire someone new, it takes a while for the new physician to acclimate in order for the workflow to reach a place it was before the initial physician left. This is something that really just doesn't sit well with me. For us to think that we can treat medical students and residents a particular way, but then when we treat our patients, we can be humanistic and caring. Well, that switch doesn't happen because a card swipe from the medical school into the hospital is not going to change how your brain thinks. And eventually, over time, if you think you can do it now, your practice and how you treat medical students and residents will eventually bleed over into how you treat patients. So we're going to end up seeing, and it's what we're seeing now, that people lack empathy in the clinical setting. People don't communicate well. People don't really care about humanism or about the patient's holistic care. And that's because we're seeing the source of it in medical education. And the reason I thought it was important to share the medical student perspective is because it starts now. I would say that it starts in pre-med, but many pre-meds pursue other things and don't necessarily go to medical school. But if we could start it there, wonderful. But we need to at least start it in medical student education so that we know that people value our humanity, and if someone values our humanity, we have that message proclaimed to us with not just, you know, wellness lectures or with free food every couple of days, but with actual, like, days set aside for us to take off. It really boggles my mind. Before my year at my school, a student could potentially work from May all the way through December and have no days off at all, aside from like weekends. They are expected to show up to the hospital every single day. And if you're sick or you get into a car accident, you are expected to come on the weekend and make that day up. So no one would ever take a day off. And if you're sick, you're going to come into the hospital while you're sick because you don't want to come in on the weekend when it's your only time off to pursue other things in life that actually make you happy, or to catch up on other things in life, or to actually study for these exams, because if you fail the exam, you have to redo the whole course anyway. So you put yourself at risk for getting ill, you put patients at risk for getting ill, and it just is this vicious cycle. Then my year came, and our assistant dean of student affairs said he had to like really advocate and like push back against the doctors and say, these students need days. That's the devil. He had to push back against them and say, these students need days off. So they ended up saying, no, they need to be in the hospital, they need to work clinically, they need to do this. And he was like, they need days to themselves. Yeah, they need to see their own doctor for their checkups, or they need a day off when they're sick. And they're like, no, they have to come to the hospital. And he ended up having to push back so much. And we ended up getting 2 days off out of our full third-year clinical rotations, where we could just take the day off. And it's wonderful. It's beautiful that we can have 2 days off. But think about that. You get 2 days off as a medical student. Two. Now it's 3. But before it was just 2. And before that, it was 0. What do you mean they get Christmas break? Back in my day, we fought to stay in the hospital. There was no such thing as Christmas break. You guys get it easy. You forget that medicine is the military. And this guy was so passionate and, like, upset. You can clearly see the mentality that, like, our humanity isn't preserved or cherished or advocated for. The fact that our Dean of Student Affairs had to advocate and push for 2 days off against such a strong attitude of just needing to sacrifice your life to medicine. And people forget that if you sacrifice so much time now to medicine in an effort to provide to patients, that's something that one of the doctors I look up to, he said to me, he's like, it's a mentality thing, you know? Every hour that you have less to yourself is 1 hour more to a patient. And yes, out of context, that makes wonderful sense. But when you're already working 10, 12, 13-hour days consistently for 5, 6, 7 days a week, you want time for yourself. It's not a selfish thing. It's just you need to be healthy in order to help other people be healthy. Because if you push yourself by sprinting all these days now, you'll end up accelerating along this spectrum to a point of no return, or seemingly no return. There's always a place of return, but you'll have to take time out, which then puts other patients at a disadvantage because they lose their doctor because their doctor has to take time off, versus putting time and effort into preserving the things that make you happy now. And I know everyone's like, how do you have time for YouTube? How do you have time for all this stuff? It's because this stuff is my, like, time off. This is how I rejuvenate. This is how I replenish my energy to then go to the hospital and still be perky and positive with patients. But I know a lot of my friends who just lose themselves along this cycle and now are gonna start residency, and they just really, I don't know if they have the tools equipped to stay in the field, because it's always been a sprint this whole time. So this whole discussion, however long this video is going to end up being, is just scratching the tip of the iceberg. Again, I said I could talk about this for days on end. All you have to do is provide me food and water, and I can keep going. I'll lose sleep over this discussion because it's something that's so important and affects so many people. And as someone who studied public health, again, I'm submitting this to the Public Health Film Festival, which, thank you for having this so that I can feel motivated, not just like personally, but also like professionally, to submit something. But it's a public health issue, because if the doctors aren't healthy, they can't help patients be more healthy. And if they leave, then patients are at a disadvantage. And who is a patient? Everyone. Everyone is a patient. That's why I don't understand how doctors can look at students and residents and their colleagues in a different light and not want to advocate for them, but then say we're supposed to do it for patients. Because these people are patients. They are someone else's patients too. And I don't know how we forget that. Your actions and your inability to see my humanity might drive me to the point where I need to go seek psychiatric care and I become a patient then. So if you only care about patients, well, I am a patient, so why don't we care about each other? And if we think that these people are superhuman and need to be treated differently and don't need to sleep as much as these people, then why don't we compensate them for that in residency? You know, why isn't medical school free if they're superhuman and we're looking out for them? It's not. It's these people are okay with being abused because they can't strike. There's really no way for doctors to strike. If the MTA strikes tomorrow, people can still get to work. There's bikes, people could still take Ubers, people can walk. But if doctors strike, you are dead. We can't have that over our heads, and we don't want that over our heads, because at the end of the day, we are humanistic, empathetic people. That's probably why we stay in it so long. It's because we know it's for you, and we care so much. But no one cares about us. Because if people cared about us, when 3 physicians died a year, there would have been an outcry. When 30 physicians died a year, there would have been a rampage. When 300 physicians die a year by suicide, there needs to be a radical revolution. But no one wants to talk about it. And one of the reasons I was really nervous about posting this, and I'm still kind of nervous, is because if a residency director sees this and they don't align with what I'm saying, the medical community is so insular, we're so incestual, that they could just send this to all the people who are residency directors, and then I will be barred from every residency program by just one video that they didn't agree with. And that's scary, because again, we've put so much time and effort and money and debt and our family's resources and our mental health resources in order to treat you and make you better and heal you and touch your life in a way that no one else can. But one slip up with the wrong person and everything goes to nonsense. Really. And it's so sad. And that's why so many people don't seek care. Because if they're at this depression stage and they're going to know they're having suicidal ideality, well, if they tell anyone about it, everyone will tell everyone else about it. And then your reputation goes down. And then no one will trust all this training that you've built up to this time and just thinks, oh, you fell off the face of the earth. Oh, you don't matter as much. Oh, you are not resilient. Meanwhile, it's just you are human. It's just a normal human thing that when you don't sleep, you become tired and you have these thoughts and you just need time away to rejuvenate and recuperate. It's not just supposed to be like a super doom and gloomy kind of video. I have 3 solutions which severely and wonderfully change all of medicine. Let's jump into them really quickly. Number 1, let them sleep. If students and medical residents and attendings had protected time where they are expected and required to sleep, then the rejuvenating and well-documented healing benefits of sleep can take their effect. Your immune system can restart. You can have cellular repair. You can have memories being stored. I remember when I was on my surgery rotation, I literally could not think whether a memory I had in my head actually happened or if it was in a dream. And I was trying so hard, and I was like, Mom, did I do this? And she was like, no. And I was like, why does it feel so real? And it's like your brain just, once you hit a certain amount of deprivation, and I never thought it'd hit this point, but really, my brain was like mush and muddled. I really could not put my finger on what was reality and what happened in dream space. And it was really odd. Imagine if you're taking care of patients' lives and you're like, did I put them on that diuretic or did I not? Solution number 2 is, if medical school were free. If medical school were free, medical students would have no debt when they graduate medical school. 3rd year, when they're actually working in the hospital and seeing patients for the doctor, seeing patients for the resident, or making appointments, or carrying urine across the hospital, or doing whatever needs to be done to help the team out, they know that, yes, it might not be the best kind of learning experience, but they're not paying for it. Someone else is paying for this. So the stress and the thought about wasting not only my time, but wasting my money is no longer there. It's just a potential waste of time. And then 4th year, when truly, most schools are now considering switching to a 3-year curriculum, which is wonderful because 4th year, I'm in it right now, is just not really useful. Once you've picked what you need and you apply in September, you're just paying more money out of pocket to interview, to fly out, to book hotels, to then interview at all these potential jobs that you're going to have when you start in July of the following year. But 4th year is not really necessary. But if no one were paying for 4th year, no one would be complaining about it. Then it's not, oh, I'm accruing $200,000 in debt, not including interest, over my 4 years, and I'm having to pay for these online resources. It's, I'm just having to pay these online resources, and 4 years out, I'm going to have $0 to have to pay back the government. So that's solution number 2. Solution number 3. Pay residents for the amount of hours that they are working. If you want them to work these inhumane hours, up to 80, sometimes 100 hours per week, because it's an average of 80 hours over 4 weeks, then pay them for those hours. Right now they're getting paid close to what the hospital cleaning staff gets paid. And they also have this huge mountain of debt that they have to pay off, not including undergrad debt, which is 4 years. Oh, we could talk about pre-med here for a very long time, but it's not even useful education for what you're actually going to do in medical school. But they have to pay off somewhat of pre-med if they have those medical school, and now you're paying them crumbs and expecting them to work all these insane hours. Meanwhile, their colleagues in other professions are respected. No one can yell at them, and if they yell at them, the human resources can get involved, and if something happens, they have a union to protect them, and medicine is very lacking in advancing and coming to the times. This should be something that's not just like, oh, let's talk about it for a little bit and then like move on. This should be something that we talk about all the time. But medical schools don't want to talk about it. One of the researchers said she was stunned at the negative reaction she received when she proposed that US medical schools start tracking medical student suicides. Officials at 2 schools said, we will not be known as the suicide school. If we track that data, the media is going to get a hold of it. And then another resident said he called 5 medical schools to see if it would be feasible to compile suicide statistics, and no one would give him answers. Yet, we are the health field. We care about patients. We care about everyone. We're so lovely. We're humanistic. Again, this is why I titled this video the way it is, because mental health is a joke in medicine. Amongst medical professionals, there is still so much stigma with having a mental health issue, with speaking about these kinds of things about burnout or moral injury, and the need for change in the system. Because once you start talking about it, everyone looks at you, there's a target on your back, you can potentially be barred from future jobs, because it's all insular, it's all incestual, and no one wants to be the one with the bad reputation, because we've all sacrificed so much. And the ones who do speak out, God bless them. But as someone who studied public health, I know I needed to speak out about it, and especially as someone who has a voice with a somewhat sizable community online, I just wanted other people to know, because it impacts everyone. It impacts every single human on this planet. It's not just a public health problem, it is a global public health problem, and that is what I studied in undergrad. I even talk about this with my friends, and sometimes they like respond back with, why do you talk about that? Like, you know, maybe you're not cut out to be a doctor. Maybe you should have just been a nurse. And like, those things are so harmful and hurtful, because, I mean, I don't take them personally, but it's just, if someone else who actually is feeling the same way sees how people respond to these kinds of conversations, why would they ever come forth with their own problems or their own thoughts or their own concerns? And it ends up being bottled up early on, so that you're forced to follow the spectrum and like follow the unfortunate journey towards suicide, which is not the out. It is not the out. It is not the out. But so many people feel that that is the out, because you can't reach out for help at any stage along this point, because we don't have a program or a mentality where the human is our primary focus. I actually had a poem that I wrote in my very first year of medical school, and it's wild how much of that I still relate to and connect. And it was interesting how much of it I was able to see from just 3 months into my medical education. At the end of it, I said that medicine needs its medication. And I believe that even more now. One of the lines from that poem that I actually am so proud of is this line: "We peel the skin of our humanity with the scalpels we use to save you." What are your thoughts about this whole thing? I've spoken so much, I'm probably going to edit half of it out because it's going to be too long to post on YouTube or to post anywhere. But let me know your thoughts down below. I'm really interested to keep this conversation going and share this with people, because this is my job. This is, I feel, my responsibility. If you feel that this is something that you care about, then I strongly encourage you to check out all these other videos that people have posted. So in summary, in closing, in conclusion, as most research articles say, this whole issue is our ethical responsibility and our global public health responsibility. And for those of you who are so focused on business, this is our fiscal responsibility to make sure that along the journey of medicine, people's lives are protected and their humanity is preserved by protocols and programs that are set in place to look out for them, just like we do for our patients. So that's my spiel. Thank you all for joining in. That's my story. Medicine, balls in your court. Or should I say, the patient is in your room. And that patient is everyone. Thank you so much for watching. I appreciate your time. And as always, be safe, be strong, be swagged. God bless you, and I will see you in the next video. You can watch some more right now. Take care. Bye! I've literally been filming it is 1 a.m. And I started researching at like 2 p.m. And then I started filming at like 10 p.m. I've been filming for 3 hours. I just finished. Thank you, God. I hope this means something to someone somewhere, and it doesn't blow up in my face. I hope it inspires and doesn't cause fires.